Hi, board members. This is Sarah McQueen, Chief Mission Officer for Healthy Futures of Texas, here to talk to you a little bit more about our health education department. In health education, we involve youth, parents, and peers to ensure positive health outcomes for all Texas youth. We work with youth and young adults ages 11 to 24 through partnerships with community-based organizations, public and charter schools, and higher ed settings. And we teach information on healthy relationships, decision-making, goal setting, and sexual health content. Through our parent and caregiver education, which is provided virtually and through in-person programming, we provide tools for adults to engage in open and healthy conversations about sexual health with the young people in their lives. We also provide peer-to-peer support through programming on our higher ed campuses. This is just a snapshot of some of the curricula that we use. You can see some of the evidence-based programs that we use, particularly through our federal grants, and the type of information that's included in those that we can also provide through supplemental education or workshops. You'll see 4 maps coming up of each of our regions. And so here in Dallas, you can see that we currently have 42 partners that we work with through a wide range of services. So this could be full evidence-based programming implementation, the provision of supplemental education or a workshop series. They could be a clinical referral partner, or really a community engagement partner where we provide tabling and outreach efforts. And there are 16 organizations that we're currently in the process with of trying to establish partnerships with for the future. In the Rio Grande Valley, we have 19 current partners, and we are working on developing 4 new partnerships in the coming year. In San Antonio, we have 25 current partners, and we are working to develop 2 partners for the coming year. And in Austin, where we really only work at Austin Community College, we have what we consider 9 partners. 3 of those are the specific campuses within ACC that we work on. And then we have several clinical partners for referrals and other nonprofit organizations that we work with to support students. When we think about health education, we want to know how many individuals we are serving. And so in 2024, we provided 4,186 individuals with sexual health education. But we know that it's not only about the education. We also engage with individuals through a wide variety of other events and activities and outreach. And so between 2023 and 2024, our health education team engaged with 28,825 individuals. But also, we're not just concerned about the numbers. We want to know the impact that we're having on the individuals that we are working with and providing education to. So we do that through a pre and a post survey for all of our programs. This image is just a snapshot of the pre-post survey data from the TPP grant in 2024, where we're really measuring changes in knowledge and skills through our programming. And so although we do have some different measures that we might be measuring for different funding sources, we've also worked to identify common measures across all of our programs so that we can tell a really cohesive story about the impact that we're having on the individuals we work with. So we think of that impact in 3 domains: knowledge, self-efficacy, and skills. So for example, we're making sure to measure across all of our programs students' increased knowledge of how methods of contraception work, their increased ability to access healthcare or advocate for themselves with healthcare providers, and their increased communication skills to talk with trusted adults. We also really value participant feedback that we get either through focus groups, just sort of anecdotally through our work with them, and also through the pre-post surveys where we always make sure to have open-ended questions. And we really use that information to help us understand our participants' experience with our programs, learn about what we're doing well, but also where we could improve. And I'll end just with this quick snapshot to show our health education team out in the community doing the work, really enjoying their time with young people and working to impact their lives across the state. Thank you.